Greetings, one and all, and welcome to the latest edition of Ask Me Anything Melrose. For reference purposes, the date of this program is November 23rd, 2020. My name is Ed O'Connell, and I'll be your host. We're live streaming on the StreamYard platform, broadcasting on YouTube, and rebroadcasting on MMTV. Our program is being brought to you by Melrose Mayor Paul Brodeur, Melrose Helps, and the Melrose Public Schools. Our guests for this episode of Ask Me Anything Melrose are three in number. We have with us Mayor Paul Brodeur, Melrose Health Department Director, Ms. Ruth Clay, and our Superintendent of Schools, Dr. Julie Kukenberger. Mayor Brodeur, before we get to some of the many questions submitted by the Melrose community, would you be kind enough to offer some opening remarks?
I would be happy to. Thank you, Chairman O'Connell. I want to thank Dr. Kukenberger and Ms. Clay for joining us. Our intention here is to give as much information as we can, as up-to-date information as we possibly can. Now, you all know this information changes on a fairly regular basis, and we'll continue to do our best to keep you up to date. But I do want to start with the obvious, and that is one thing that we've known pretty consistently almost from the beginning is that our best defense against the spread of the virus remains true as we make this broadcast, and that is to please wear your masks, practice social distancing, practice good hygiene, and if you do suspect you have symptoms, please stay home. That goes for your entire family. We are going to endeavor, again, to answer as many questions as possible, all three of us, and with that, I would say, let's get to it.
Great. Thank you, Mr. Mayor. And as you say, let's get right to it. Superintendent, if we could start with you, please. We've had a number of questions about who gets notified when a student or staff member tests positive for COVID. And let me give you some prompts, if I may, by way of some of these questions. Is everyone in a class a close contact? Is every class member notified of a class member or teacher infection? How does it work in a hybrid class? If a student or teacher tests positive during either the at-home or the in-school week, is the entire class notified? And lastly, by way of a prompt, should a child in a class with a positive test class member also get tested? Should they quarantine? Stay home for 14 days? What say you, Superintendent?
Thank you. I'll try my best to remember all the parts of that question. One of the things I'll say about our communication is that, we've been increasing and improving our communication each time. So although we had some template letters that were prepared for a variety of scenarios, what we learned very quickly was that every situation is just unique enough that we really have to, there's some certain information that we're going to include in all of our communication, but then there's some more specific and nuanced information. So I'll start with a student who's in the Melrose Distance Learning Academy or the MDLA. This is a student who's all remote all the time. We are still communicating with our community when we find out that there's a staff member who is remote or a student who is remote. And so one of the things we think about is who needs to know this information. And that really depends on the type of contact the student has had with the school community. For example, a student may be completely remote, but still participating in athletics at the high school. So in that case, we would communicate with anyone on that athletic team. And there's two letters that would go out. It would say, one, an athlete on your team has tested positive, you are not a close contact, or you are a close contact. And they're going to be two different letters because there's two different things that we want you to do depending on the situation. And that's very similar for our students who are learning in person all the time. So those are our Group C students who are all in person all day, every day. Again, once we learn that there is a positive case, whether it's a student or a staff member, right away, we're working with our nurses in the Department of Health, and we're trying to understand who may be a close contact. And that can take us a good part of a day to really get to the proper information in order to make sure that we're communicating as clearly as we can. Once we get that communication, we're communicating with the staff and students who are directly impacted first. Sometimes we might learn that a student in a class, their parent has tested positive, and parents have been very forthright with that communication, which is helpful. So we might not be ready to send a school-wide or a classroom-wide communication, but we may be communicating directly with some staff or some students, depending upon the level of contact that the student has had with folks. And that's just like a super precautionary measure. When we have a confirmed positive case, we're talking to those folks first. We're sending letters directly to the class. So everyone in that class, or if it's the middle school or high school, it could be multiple classes, will be notified that a student or a staff member who you've been in contact with or who is in your class, if it's elementary, has tested positive, and here's what you need to do. And there's some next steps outlined. We also then send a letter to the whole entire school community. And it will be less specific than that classroom letter, but it still will say that a student learning in person, or a student who's learning remotely, we had a case at the Lincoln School. It was a student who's a hybrid student, but they had not been in school for at least 7 days. So, when we're thinking about the data count, that student's going to count as a remote student, even though they're in the hybrid rotation. And luckily, with our 9 days away from school, with our 5-day in, 5-day out rotation, we were able to unfortunately learn that information over the weekend, and we're able to notify folks ahead of time. And obviously that student wouldn't be returning back to the school community during their in-person week. So that's kind of the general sense of the communication. We're starting with the people that are closest to the positive case. And then we kind of work our way out to the full school community. And then district-wide data, we're publishing on our shared MPS COVID positive case count dashboard that we're building out and will be up on our website soon. I think another part of that question was, is everybody in the class considered a close contact? And the answer is, it depends. So the protocols that we have put in place require that all students are wearing, and staff are wearing, a mask all the time, with the exception of snacks, lunch, and mask breaks. And when that's happening, windows are open or students and staff are outside. And so if we're wearing the masks and if we're keeping the physical distance, so remember, we chose to exceed the 3 feet minimum distance and maintain the 6 feet of distance so that we would have fewer close contacts if and when a positive case comes into school. And the way that every classroom is set up is that students are 6 feet apart, seat to seat. So long as students and the teachers maintain that distance, there should be very few close contacts in a classroom and in the school when there is a positive case. And so in the hybrid, just to kind of go back, we think about, who was in, whenever we learn of a positive case, my first question is, when is the last time this person was in school? Because that really triggers for us kind of what our reactions and next steps need to be. And so depending on the answer to that, you're going to get different types of communication from us. Did that capture it all?
It did, and then some. Thank you very much, Superintendent. Ms. Clay, if we could go to you, and if I could just ask you a general question, and then we'll get into some specifics. If you could tell us how contact tracing works from the perspective of your department.
Okay, it's become a little bit more complicated since we started, but basically, the basic case is that either the person notifies us directly that they've tested positive, or we see that case positive in the electronic data system called Maven. So our public health nurse checks Maven multiple times a day and is notified all during the day as new positive cases come in. We contact the case. If it's a student, we contact the parent, obviously. One of the questions was, are we talking to 6- and 7-year-olds? No. We are talking to the parents, and when it's a young child, That's pretty reliable. When it's a high school student, could be less reliable because we know that teenagers don't share everything with their parents. But we get we do the best we can with the information we have. So the first part is the case management of that case. We check to see what kind of test was done, when it was done, when their isolation starts, when it stops. We have a conversation with them, answering any questions they have. We send them written information by email about what you can and cannot do in isolation. And we identify close contacts. Now, if it's a student, we are usually working with the school nurse. So it's a combination of, and many times the school nurse takes the lead on the contact tracing. They already have a relationship with the family, the student, they know something about them and their activities. And so what we're asking the parent or the person, the adult, is who have they spent 15 minutes or more within 6 feet during their incubation period? And we outline to them the time frame that we're looking at. They identify those people, and then we contact each of those persons. We don't tell them who was the positive. We say, hello, Jane Doe, you've been identified as a close contact of somebody who tested positive. This is what this means. You need to go into quarantine. This is what quarantine means. We send them something in writing, again, that explains it, and they go into quarantine. One of the issues that we have been having is people not being forthright with us about their activities and their contacts. And we know people are doing things that are not encouraged, like socializing and whatever. And they're afraid to tell us that. But they shouldn't be afraid to tell us that. We're not going to yell at them. We're not going to scold them. We just want that information so we know who else to contact so that it doesn't continue to spread. Because if we don't know who those people are, and they don't know who they are, they will continue to be out in the public. And a lot of times people say, oh, I've already contacted them. You don't need to contact them. Well, yeah, we do need to contact them because we want to make sure they have correct information, give them the opportunity to ask us questions. So it is important that we contact those people. So that's what we mean by contact tracing.
Very good. And a follow-up in that regard. We know there's been some positive tests at the Hoover School and in a couple of our other schools as well. And in your contact tracing or with the contact tracing, are you able to determine to a reasonable degree of certainty where the transmission is coming from? And I think you know what I'm getting at. It's the question of, are we seeing in-school transmission?
Yep.
Or out of school transmission?
Yep, it's a good question. And remember, I'm monitoring 2 school systems, Wakefield and Melrose. And I can say between the 2 school systems, that Hoover incident is the only in-school transmission. Every student that has been positive almost all of them are positive through their parents. The parent tests positive, they test the rest of the family, and 1 or more of the other people in the family test positive, which is one of the reasons why our numbers are increasing as quickly as they are. Because instead of 1 case and we go up by 1, for each 1 case, we're getting 3 or 4. So you can see how that number is going to increase very quickly. But very minor number through sports, but almost everyone has been through an adult in their life. And I just want to take this opportunity to correct something I said earlier, is that it's not a correction, but it's an addition. Because of the volume of cases that we have, even though we have hired many more people to help us with contact tracing. There is the state program that I'm sure everybody has heard of called the CTC program, Community Tracing Collaborative. Anyway, when we can't handle the number of cases, we hand those cases off to the CTC. And so it won't be one of our nurses that contacts you. It will be somebody else. They do the case, and then we do the very end to clear the case at the end. So super important. And I know we all try not to answer the phone when we don't recognize the phone number. But if you have any indication that you might be getting a phone call, i.e. you've been tested and you get a phone number that you don't recognize, please answer it. The worst that happens is it's spam and you hang up. But a lot of times that phone number is somebody trying to reach you on contact tracing. So again, you might be getting it from the CTC.
Very good.
Can I supplement that?
Please, Mr. Mayor.
I just want to supplement that just a bit. It's one of the things, and Ruth, correct anything I say that might be incorrect. One thing that the state is now tracking, and I suspect it's a little bit of an imperfect science, but they're identifying clusters in various ways and number of infections related to those clusters. And there's probably 20 or 30 categories out there by far and away, by orders of magnitude that are huge. Household clusters are the biggest clusters. The next, on the order of thousands. The next highest cluster is long-term care facilities, and those are maybe double digits, and then fairly dramatically drops down from there. So put some numbers on what Ms. Clay was talking about in terms of not necessarily where the transmission comes from, but where those clusters are. It is overwhelmingly
that information.
household.
If you go onto the state's website and go onto their dashboard, it's the graphs are there, and they're tracking it over time, and anybody can see this. It's the aggregate of the state, not by community, but Melrose is not different than the other communities, and our clusters. At this point, all of our clusters have been household, all of them.
Very good. Thank you both for that. And Mr. Mayor, while we have you, a little bit about information sharing. And you've had an opportunity to look at some of the questions we've received in advance. A number of community members have noted that Wakefield has a community COVID dashboard on its website that includes a summary of school data. And we've received a couple of questions asking if Melrose has a plan to do the same on our website.
That's a great question, and Dr. Kukenberger might have to jump in a little bit, but we are in the process of putting those numbers onto the city website. We essentially have two different sources, and we want to make sure the information is the same and is consistent. So one thing that we've already done is sure was a little bit frustrating for people is on the Melrose city side homepage, there was a tab, I want to say on the left, for COVID information. You kind of had to click through a little bit to get to our COVID information hub. That is now, I'm happy to say, kind of one-stop shopping. When you click on the homepage, you'll be brought right to that page. And we are going to start putting the school site numbers on there as well, much the way that Dr. Kukenberger is presenting them. However, folks really do need to understand there are certain, you really have to understand the data, that there are certain limits to, I guess, say like the kind of the cross reporting, so that, as an example, Melrose data, community data reflects information about Melrose residents, whereas school district information contains information about students that attend the Melrose Public Schools. So as you know, that means a couple of different things. We may have students that are Melrose residents that are not Melrose Public School students. They might go to MC or the charter school, wherever the case may be. And we also have students that attend the Melrose Public Schools that are not from Melrose. We have Medco students that come from various places in the city of Boston. We also have certain somewhat unusual circumstances where folks might live in other communities but still attend the Melrose Public Schools. So the data won't line up perfectly. We also, when the pandemic started, I was doing really essentially daily video updates that focused on the counts. The counts moderated somewhat, which I think made that information on a day-to-day basis a little bit less relevant. And I am happy to, maybe not with a video process, but on the website or some other place, track that data on a daily basis again, because the numbers are, as Ms. Clay can tell you, they're coming back, and they're coming back with a vengeance. So I think it's for folks to understand that. You got to understand the limits of the data, but the trends are super important, and we can get back to that for sure.
Thank you, Mr. Mayor. And you touched upon another question that we had. I'm sure you saw it as well. I think people have grown accustomed and value your regular updates. Can you give us an update, if you would, on that kind of reporting and information sharing from the mayor's office?
Sure. I've tried to do a couple things. I mean, I want to be consistent. I want to have a data stream, if you will, that you can count on. And I've tied that, what I've done, up until now, once we switched to weekly, was really use the weekly state data that was community-based about cities and towns as the jumping off point for a lot of the data that I pushed out into the community, and that does appear on the website. We've also tried to, when there was a need for additional information, we try to put it out as many ways as possible, most commonly through Twitter and through Facebook, but also when the need arises, using Everbridge, which hits more people. It's a little bit tricky to make sure we're hitting every kind of information channel that's out there, and we certainly do our best. One thing that I'm a little bit regretful of is that we try to use our two newspapers as much as possible, but the information tends to be, it has to be put up more efficiently than weekly publications sometimes works for. But again, we also have that concern that is the kind of the source of the first source or primary source for some members of our community. So we'll continue to do as best we can what we feel works. And again, and Dr. Kukenberger also supplements with school-specific or district-specific information as best we can, and we'll just keep at it. And certainly, if folks out there think we're missing something, or if there's a way we can continue to put out information or improve on that, we certainly want to know, because I'm also mindful of this balance. I get a little bit worried that if I use Everbridge too much, that people are going to stop listening to Everbridge. So we do try to make a little bit of a value judgment about what is worthy of that level of treatment.
Very good. Thank you, Mr. Mayor. And Dr. Kukenberger, while we're talking about dashboards, you did mention something about the build out of the school's dashboard. Can you elaborate a little bit on that?
Initially, we had been reporting out just to individual schools, and we heard from our community that they wanted more information. They wanted to know when cases were happening in other schools as well. So I thought a lot about the best way to do that. And similar to what the mayor is saying, I did have some wonders and worries about sending a letter out every time there's a positive case and having people sort of, not be paying as close attention to it maybe when it comes through, or just thinking that it's another form letter. And that's not what we want. We want, when you get a letter from your school principal, and we've tried to put right up top of the letter, like positive COVID case or update on positive COVID case. So doesn't necessarily look like a traditional letter, but we want that headline to just sort of grab the reader. And so that's coming to you when there's something that is directly in your school community or in your classroom or in one of your child's classes. The district dashboard is this coming together like a little bit rainbow colored month by month so that folks can draw their eyes to where the positive cases are. And we've added, we have sort of the aggregate data up top, and then we've disaggregated it school by school. And we're looking at 4 different categories: student, in-person, and student who's remote or MDLA. And so anyone who has been away from the school community for 7 days or more is being classified as a remote. And then we have the same data for staff. So we're looking at staff in person and then staff remote or MDLA. And just over the weekend, when unfortunately we learned of a positive crossing guard in our city, I had to think, well, how do I report that? Because it's not in person or remote really. And so we have each of the schools going down, we added district at the bottom. So this would be like when DESE classifies this, they call it like no kid contact. But that's not necessarily true for our district level employees either. So when you see district, that means that it's someone who serves multiple facets of our school system on that dashboard. And we are building out with the support of our webmaster. We're hoping to launch this right after the Thanksgiving holiday. Up top on our webpage where you see like home, district, schools, school committee, staff, we're going to add another title that says COVID-19. And that will be that one-stop shop like the mayor's building on the city's website where you click right there, you'll find that MPS positive case count. And then any other important resources, our return to instruction plan will be there, our cohort rotation calendar will be there, and any other tools that we think are going to be high value for families. So that way, the wellness forms will be there as well. So that way, when you're trying to navigate the website, you know right where to go if that's the information you're looking for.
And can I just I want to just build on what the mayor was saying, is that the numbers on our dashboard, on the school department's dashboard, will not match the dashboard on the DESE website. Because the DESE website only talks about students and staff who have been in school in the past 7 days. So it's a subset of the superintendents. The superintendents have way more information.
Very good. Thank you for that. And Superintendent, if we can stick with you for a few moments. We've had a number of questions about protocols and use of classroom and other spaces in our schools. And not to harp on the Hoover test results. Again, I know we've had positives in other schools. But in your opinion, Doctor, what do they tell you? What do those test results tell you about the protocols? And I guess ultimately the question is it an indication that the protocols are not effective or not being used or perhaps just the opposite?
Yeah, I think it really does indicate the opposite. Of the cases that we've had to date 9 student in-person cases, and just a few staff in-person cases. And with the exception of that one Hoover, well, we've had 2 situations where close contacts have been identified within the classroom. And so for 2 really different reasons. A lot of that has to do with the needs of the students in the classroom and the age of the students in the classroom. And so we have several protocols in place that are really proving to really help us mitigate the risk. It doesn't 100% eliminate the risk. You hear me talk about risk mitigation all the time. We have to every day make calculated risks within the school system, and we're weighing a variety of things all at the same time. But at the elementary level, where we've seen the most number of in-person student cases, I believe that our numbers are as low as they are because of these protocols. So one of the things we're doing is keeping students in the classroom with their teachers all day long. In a traditional school year, they would be traveling to lunch, they'd be traveling to specials like art and music and phys ed and digital literacy and library. They're not doing that at this time. They're staying in that classroom with their teacher and receiving those services remotely, and lunches are being brought to the classroom. And depending on the weather, teachers and students are deciding whether they're going to eat lunch in the classroom or outdoors. And you'll see lots of people, lots of students and teachers using outdoor spaces as much as possible. And that's something that we really encourage. If the weather is like today and they're not going outdoors, then we want them to have their windows open. Even though our HVAC system, our HVAC assessment came back to say that we have ample air exchange in our schools and filtration, and DPW has done a great job. I was at the Roosevelt last week and I saw a whole shipment of new filters coming in, so I know that they're getting ready to change those out again. We still want teachers to keep those windows open and get that air pulling in. One of the things that we're also doing, it's as an added improvement to the air quality and to our protocols, is adding HEPA air filters to every single classroom. So we prioritize the Hoover first. I believe they've all been deployed. Our second priority was the classrooms at the high school that don't have any windows. If you could believe it, there's like 40 or more classrooms at the high school that don't have any windows at all. And that's just an added improvement that we wanted to, as the winter months come along, we want teachers to still keep their windows open at least 3 inches, but realizing that having them all the way open would not be an enjoyable learning experience. So that's a protocol that we're putting into place as we go into winter. Additionally, so it's the minimizing the transitions, it's de-densifying, so keeping that 6 feet of distance, having those staggered arrivals and dismissals, so we're not having big clusters and clumps of students interacting with each other, has also proven effective. And then I really think the biggest protocol has been our 5-day rotation. As inconvenient as it sounds, it really has proven multiple times to help us prevent a student who has been exposed or who has been asymptomatic coming into the school community and then testing positive. So we've had a number of situations where it might even show on our data that it's in person, but the student really is learning from home. So that's kept our number of close contacts super low. In the situation in the Hoover classroom and in one of our Group C classrooms where we did have close contacts, that really had to do with the ability and the age of the students. And so what that also shows us is in those classrooms where all of the students were identified as close contacts, because they aren't able to maintain that 6 feet of distance, or they weren't able to maintain that 6 feet of distance, that's when we saw positive cases. That was our one incident of, I would say, classroom spread, not school spread.
Very good. Thank you for that. And let me, speaking of protocols, let me read a specific question in that regard. One community member writes, I am aware that DESE, the Department of Elementary and Secondary Education, DESE does not require an entire classroom to quarantine for a positive student or teacher result, but rather only those considered close contacts, as we've been discussing. Would you, Superintendent, consider enacting stricter protocols in terms of our response to positive tests? Do you think that is necessary or appropriate?
So one of the things we also have to weigh when we're thinking about risk mitigation is, what's the risk of students not being in school? And we know that nothing replaces in-person learning. And although many of our students who are in the MDLA are able to thrive, our students who are learning from home, those weeks are really challenging. That's been something that was really clear in our data, particularly at the youngest grades. And so we want to keep students in school learning in person as much as possible. And we want to follow all of the protocols, and we want to be really conscientious so that if there is a positive case, our teachers are working with our nurses to provide seating charts and to ensure that they have all of the information they need to adequately contact trace. But we have no evidence at this time that having a positive case and allowing the rest of the class to continue with their learning plan has led to more spread, if that makes sense. So we've had positive cases that have been isolated. The students have been in-person learning, maybe out for a couple of days. When we go back the 48 hours from the positive test or symptoms, we're doing all the proper contact tracing, but we haven't seen then, because the class stayed in that learning model, there's additional transmission, if you will. So we're going to keep using data and evidence to make our decisions, I guess would be the short answer to that.
Very good, thank you. And Ms. Clay, is all of that in keeping with what you're seeing from your perspective and what you think is the most appropriate response when we get a positive test in the schools?
Absolutely, absolutely. There's no reason to quarantine the whole class if they're not close contacts. And again, if everybody is able to follow the protocols, and there are certain circumstances for a particular student when that can't happen, but in general, there are no close contacts at school. A student is positive due to a different exposure. They're isolating at home, but there's no consequence to the rest of the classroom.
Very good, thank you for that. And Mr. Mayor, you're talking to your counterparts in other cities and towns. Are you seeing or hearing any more of I guess I would call it a more restrictive response to positive tests in the schools or elsewhere in the community?
No. One thing that I will say about the mayors and the town executives, town managers or administrators, particularly in Greater Boston, is that we are really trying to not act individually with broad-based policy. As an example, I suspect it will come up. Are we going to close restaurants? Well, the short answer is no, not at the present time, because there is really only value in doing those kind of steps if everyone's acting in concert. If Melrose closes their restaurants and everyone from Melrose goes to Wakefield, Boston, wherever the case, and then comes back, we haven't done anything proactive. We haven't done anything good from a public health metric, and arguably have done a little bit worse because we're almost encouraging people to circulate. Everyone, I mean, different communities certainly face different challenges. We have, somewhat better results than some of our neighboring communities because of different challenges that they face. But from the school perspective, folks are doing their best to react to the evidence on the ground. So there are communities that are full remote, but at their heart, they are making those decisions based on the best data available to them for their districts. And we continue to have access to some of the best public health experts, folks from all the major teaching hospitals and beyond, to really give us their best advice at the time. And we do our best to apply that, recognizing to Dr. Kukenberger's point, we really want kids to be in school and to, sort of to kind of double down on the rest of the advice we give. What I opened with, those basic precautions, part of that is to allow our businesses to stay open as much as possible, to give our kids the best opportunity to stay in school, to be able to follow those rules, take some, really, really ultimately simple precautions for most folks. That is certainly a message that's being driven at the state level and across Massachusetts at the municipal level.
Very good. Thank you for that. Thank you for that perspective. So we've all had an opportunity at various points during the day today and over the weekend to look at some of the questions we've been receiving. And it was not lost on any of us that people are very anxious about Thanksgiving and the impact and import of people traveling out of state, potentially to so-called higher risk states, and then coming back. And the questions were interesting to see on a number of levels. But for you, Superintendent, a number of those questions were directed at the schools and asked, what are the Melrose Public Schools going to be doing, if anything, to heighten our restrictions, protocols, guidance in response to what a number of people are suggesting may be an increase in the rate of infection. Any thoughts on that, Dr. Kukenberger?
So at every chance I get, I'm trying to just encourage our community and our staff to think innovatively and creatively about what type of new memories can you create this year. The number one thing is not about what we can do, it's about what you can do. And so we need everybody to celebrate small with just those people that live in your household. We need you to not travel. I think, in my family, we're thinking about fun ways to connect with family remotely through Zoom. And we have some fun things scheduled with like my nieces and nephews and, my brothers and sister. And so we're trying to think really differently because one of the things we all agree on is that, we're missing out on some of our traditions and we feel sad about that. But the memory we don't want to create is the memory of us all coming together and then everyone getting sick with COVID. And we've heard about this happening from family gatherings, small gatherings. I like to operate under the assumption that everybody has COVID. So I need to really own my piece of maintaining my own COVID negativity by being vigilant with mask wearing, hand washing, monitoring my own physical distance, checking myself daily for symptoms and, really understanding how I'm feeling each day. And, I just would encourage everyone in our community to do that. Some have suggested that we should close the schools for the week after Thanksgiving or 2 weeks after Thanksgiving. And that's just really not going to do it. And I am fearful that that is like a false sense of security, thinking that that's how we're going to stop the spread. Because the only way that would work is if every single student leaves here at noon on Wednesday and goes right home and does not interact with anyone else and just stays home for the whole weekend. And then maybe closing the schools for 2 weeks after everybody quarantines and nobody grocery shops or goes anywhere. Then maybe that would be something that would be be worth the investment and the loss that students would have in terms of in-person learning time. So the real thing, we need folks to do is just stay home, celebrate small, be creative, be innovative, and just know that, 10 or 15 or 20 more years of Thanksgiving is more important than having that Thanksgiving this year in that same traditional way.
Very good. Thank you for that. One specific question in this regard that was asked was, would you consider revising the daily wellness check to require certification of no travel?
That's not something that I had thought about, but I think given now where there's really only 2 states last I checked, you can travel to, Hawaii and Vermont, that could be something that we can consider adding.
Very good. And Ms. Clay and Mayor Brodeur, I'm going to ask you the same question because a lot of these questions were directed at the city as well, in some kind of expectation, I think, that we were going to, as a community, as a city, we were to ramp up our protocols and restrictions in some way in the period of time after Thanksgiving. But I'm guessing that your answers are going to be a lot like the superintendent's. Ms. Clay, any thoughts about how we deal with perhaps potentially increased rates of infection after Thanksgiving and beyond?
Well, there's been a lot of questions statewide about travel advisory. What do you have to do before? What do you do when you come back? And so I know the state has increased their communication on that. And one thing we can do is increase our communication on that particular subject through, through the mayor's videos, through adding more links on our website, doing some signage in the kiosk, coming out with a variety of ways of getting that particular message across. Because one thing we've seen over time, long time, is that the concerns of the public change over time. And right now, the primary question is travel and quarantine. especially since the state recently changed the quarantine guidelines. So this is a really good opportunity for us to kind of take that as our primary message right now. And we have a lot of ways of getting that information out.
And Mr. Chairman, if I could, let me be a little bit blunt here, is we are the government. We are not going to enforce or regulate our way out of this problem. Ultimately, this is a challenge to the community and it requires a community response. We all miss, depending on kind of what stage of life you're at, you miss play dates, you miss birthday parties, you miss the idea that, you know, is baked into our community that we want to be together with a family and friends on holidays. And that's not, that unfortunately, and it's heartbreaking for some of us, particularly depending on the circumstances, is that you just can't. My parents are in an assisted living facility a mile away. I'm not going to see them, and it sucks. There's no good way to do that. But that is unfortunately where we're at. We are relying on that social compact, on the ability of us all to say, all right, we're going to have to sacrifice now for the greater good. It is not about politics or ideology or anything like that. The science is pretty simple, and the trust we have to have in each other and our ability to like lift each other up and help each other cope is how we are going to get through this. As even we've heard some great news about vaccines, 3 or 4 different vaccines coming along. That is still going to take time to test, to replicate, and to deploy. We are 100% ready to do it. We have practiced it in other settings a bunch of times, but that is going to be a process. And all during that process, we got to lift each other up. We got to do the right thing. And like I said, we're not going to be able to, I said it before, I'll say it again. Sorry to be redundant. We're not going to enforce or regulate our way out of this. And you know, one of the reasons why I think all the stop the spread testing sites are very pressured is A, because infections are going up. We know that. But I suspect it is also people that are trying to get that test before they travel somewhere. And that's not what the test is for. The test is not going to provide you with good information that it is good, that it is safe to travel just because you hopefully get a negative test. I will quote Governor Baker. Spending a lot of time indoors with many family and friends is exactly how the virus spreads. And that is something that is not the governor saying that on a whim. That is based on his constant interaction with disease experts. With, you know, we live in the place where the best of the best do their business, and those are the people he is tapping. So believe me, I understand and feel in my own life that frustration. What the superintendent said about trying to create new ways of doing things, new memories, and building for that future, that's where we got to be. And I hope we can all do that.
Thank you, Mr. Mayor. Good points and important points. Superintendent, back to you for a moment, if I may. I know we have fairly stringent cleaning and sanitization protocols in the schools. Do those change, Superintendent, when we have a positive test result, either from a student or a staff member? Do we suddenly ramp up the cleaning protocols? And let me also add, we're going to be talking a little bit more about transmission in a bit, but just in terms of our initial response.
Sure. So our daily cleaning protocols are designed to disinfect as many surfaces as possible every day. From the time students leave, our custodians are working through the night. We ask that all of our educators leave the buildings by 4 so they can have the most efficient and effective cleaning protocols in place. And so a couple of things that are happening every night. Of course, the regular kind of cleaning the classroom, sweeping the floors, mopping, emptying the trash, cleaning the bathrooms, things like that. That's always happening. But then this year, DPW invested in electrostatic machines. And so these machines kind of look like a Ghostbuster backpack, and they hold a disinfectant solution that when sprayed on clean surfaces and allowed to sit for 15 minutes, will disinfect, is highly effective at disinfecting and killing the coronavirus. And the electrostatic technology of it allows it to cling to surfaces. So it's not just sitting on the top of the surface, it's getting kind of around and under desks, chairs, all of those things. Our teachers have also done an amazing job of creating classroom spaces that are free of clutter. And they've really taken a minimalist approach so that cleaning process can be even more efficient and effective. And then on the weekends, there's a deeper clean that happens. So they do their cleaning on Fridays. There's another crew that will come in on Saturdays and do that disinfecting. And they also on the weekends clean inside the desks so that in preparation for a new cohort of students to come in, those areas are disinfected as much as possible. And when there's a COVID positive case, typically we learn of it not in the exact moment, right? It typically happens a couple of days after the students have been absent from the school or a staff member's been absent from the school. And that's why those daily cleaning protocols are so essential, because we never know when a student leaves, when students leave at the end of the day, what actually is in that room. So we act like every day we're cleaning for COVID. And then if someone gets sick, let's say someone vomits or has a potty accident or some sort of bathroom accident during the day, then at that point, a classroom would be evacuated. The custodian would go in and appropriately clean depending on what the issue is. And then using that electrostatic machine again during the day. And then we let the classroom be empty for 30 minutes before we bring students and staff back into that space. So there needs to be the time to clean the space so that we can actually disinfect the space. And we really do three things throughout the day as well. There's cleaning, which we're using soap and water so that students can also use soap and water to clean surfaces that are soiled. That's happening throughout the day. There's sanitizing that's happening. That's an adult only job. That can only work when surfaces are clean. And then the disinfecting is only done by adults. And so we've had a couple of situations where someone has gotten sick. We've needed to go in, clean the space, sanitize the space, and then the custodian will disinfect. It takes 15 minutes for that to sit on the surface to do its job. And then we leave 30 minutes for it to dissipate so that when the students come back into the room, they're not breathing in all of those chemicals.
Very good. And Ms. Clay, if I could jump to you, and if we could talk just briefly about transmission. We hear about surface transmission. We hear about airborne transmission. What's your sense of the relative importance or impact of each? Obviously, we're doing an awful lot to address surface transmission. I'm going to go back to the superintendent to talk about air quality, but what's your sense of transmission as an issue? Oh, you're muted. That's good.
Sorry. Transmission is clearly airborne in reality. Transmission through surfaces is theoretical. It's theoretically possible, but there haven't been any cases of infection that have been shown to be through a surface. So I'm not saying that we shouldn't clean and disinfect surfaces, because certainly we should, but staying away from each other is really the way. Just like with the flu, when we tell people that it's transmitted through the air, and the further away you are and the more barriers between you, the less transmission there's going to be. So it is still definitely an airborne transmission.
Very good. Thank you for that. I'm glad I asked. And given that reality, Superintendent, where are we with air quality in the schools? You mentioned it earlier, but if you could elaborate a bit on that. And you're muted.
You're muted too.
Thanks.
trying to be polite when I'm not speaking. During the summer, we had a full HVAC assessment done in all of our schools throughout the city. And DPW really headed that up. And we hired an outside company to come in and to look at all of our machines and to really look at air exchanges. And I'm not going to use all the right jargon, all of the right HVAC jargon. But what we learned was that we do have adequate air exchange. We are able to pull in a lot of outside air. Some of our systems are newer, some are older. And it doesn't necessarily go along with what the building looks like from the outside. You know, some of the older buildings have the newer systems in them because they've been replaced over time. And then really encouraging teachers to keep the windows open as well, as much as possible. And one of the things that we were worried about were those classrooms that don't have windows. And we were very pleased to learn that there is proper air exchange in those spaces as well. And that really has allowed us to keep as many students in person learning as we have been, because all of our spaces have been appropriate to use for instructional spaces. As I mentioned earlier, we chose to use our coronavirus return to instruction grant to purchase HEPA air filters for each classroom. They have, the filter lasts for 5 years. So we felt like it was a wise investment, both in these COVID times, but then also something that we can continue to use in the classrooms just to help with seasonal allergies and other type of, air irritants, if you will. But again, we're still asking that teachers keep the windows open at least 3 inches, because we know in combination, the HEPA air filters with that additional outside air coming in is going to just improve the air quality. And so we don't want to just have good air quality. We want to have the best that we can create. And so I was really happy when we were able to make that investment for our students and staff.
Very good. And Ms. Clay, based on what you said, I'm assuming you think that's a wise and prudent investment and is rightly the focus of where we're at. Is that correct?
Absolutely. And I'm glad Dr. Kukenberger mentioned the added benefits, because it will help with flu virus. It will help with allergies. It will help kids with asthma all during the school year. So, it's an investment that's going to help us address other issues besides COVID-19. Very good. Thank you.
And while I have you, Ms. Clay, and all of you, but we'll start with you, Ms. Clay. We've been reading in the news lately about a fairly new initiative of the Department of Elementary and Secondary Education with regard to rapid coronavirus antigen testing, and a new initiative. And the Melrose Public Schools will be one of the districts where this is being rolled out. What do we know, and I realize it's early, but what do we know, if anything, at this point, Ms. Clay, about what this is, what it's going to look like, and how it might work in our schools?
Well, there's some information that we know and some information that DESE is still figuring out. We know that this antigen test is more accurate than the other antigen tests that are out on the market right now. I know you've heard me say ad nauseum to people to discourage people from getting the antigen test and get the PCR test, because essentially you need to get retested anyway. So it's kind of redundant. And if it's a child, unnecessary to put them through the test. Not that it's a bad test, it doesn't hurt, had it done myself multiple times, but younger kids certainly have a lot of angst over it. So, but this test, they have been doing a study for several months now on it. Study's not done, but the preliminary results are very promising, that it is more accurate. The state has not removed the protocols about being retested at this point. Hopefully, if the results continue to be positive, that might be something they'll be able to do. But I do think there's a few things that need to be really clear about this. So first of all, it is only for students and staff who developed symptoms during the school day. It is not for kids to come to school sick so they can get tested by the school nurse instead of going to a testing site. If they come to school with symptoms, they're going to be sent home. They're not supposed to be in school with symptoms. However, during the day, sometimes somebody develops a headache or develops symptoms. In that case, they would be offered this test. So realistically, it's not going to be used a lot because it's not a screening test for the general school population. Again, you have to have symptoms. It is not for an asymptomatic person. It is not a screening device because you think your child might have been in contact with somebody, so you want your child tested. If they have symptoms, they should not be coming to school to begin with. This is only if a student or a staff develops symptoms during the day. I can't
Very good.
underline that enough.
Dr. Kukenberger, is that in keeping with your understanding? Anything to add to that at this? And again, I know we're early into this.
Well, what we know right now, in addition to what Ruth has said, and I underscore, underline, highlight, bold the same statements. What we know today is that even if a student tests positive, even if a student tests negative, if they're presenting symptoms, they're going to be sent home, and a PCR test is still recommended. These are just presumptive results. They're not meant to be diagnostic. So again, it's not the solution to going to a Stop the Spread site and getting an actual PCR test. It's just another tool in our toolbox for our nurses to have. I think one of the biggest value adds from what we know right now is that if a student is presenting an isolated symptom, like just a headache or just a runny nose or just fatigue, the nurse could use the antigen test. And then if it's negative, if it's positive, obviously it's going to be a presumed positive. They're going to be sent home and treated like a positive case. We're going to communicate with our school community to say, today, a student in your class or a student in the school community tested positive with the Bionox, rapid antigen test. And that'll be a signal to everyone that we're treating it like a positive case, but it could change. If they get a PCR test and it's negative, which can happen with these antigen tests, we're going to then send a communication about that. But we're going to alert everyone as soon as we have information. And then if it's that isolated, I have an isolated headache, just a headache, or I'm just fatigued, or I'm just experiencing nasal congestion, and a student tests negative or a staff member tests negative, they can return to the school community if it's an isolated symptom. So that's new. That's kind of different information for us. And so we'll be working closely with our nurses to really refine what will our protocols and procedures be here in Melrose as we get ready to implement this test. But we're still a good 3 weeks, maybe even post the winter break out, depending on how things develop over the next few weeks.
Very good. Thank you for that. And Mr. Mayor, if I can ask you a question somewhat related, and I'll start with you, but I suspect Ms. Clay and Dr. Kukenberger will weigh in on this as well. I ask you, Mr. Mayor, because I know you've been working closely with Somerville Mayor Joe Curtatone and your counterparts in our other neighboring communities. We've been hearing about this pooled testing model, if you will, that Somerville and Medford are involved with Tufts University. Are we hearing that may be expanded to include other communities, or?
So I appreciate the question. As I did have an opportunity to talk to Mayor Curtatone about that very subject a little bit earlier today, and he has very generously offered to share his team's wisdom with Melrose about how they stood it up and the value that can be derived from that. I think what we ultimately did is a couple of contradictory things. Massachusetts really does lead the nation in terms of testing, and Massachusetts testing is inadequate. Both those things are true. at the same time. And I think what we're going to get to, and this is, like maybe an educated layman's perspective, is that we're going to get to a point, hopefully pretty quickly, where we use all these different tests as tools to control the spread, so that the PCR right now is kind of the gold standard in terms of accuracy of result. The rapid testing that we just discussed is getting better. It still has its limitations, and surveillance testing, just so folks know, is essentially, and please, Ruth, if I get this wrong, correct me. You essentially, it's asymptomatic testing where you test a subset of the population kind of at random. You pool all those tests together and they get tested. It's a lot cheaper is the good news, but it will not identify specifically who within that testing group is positive. So you use that to test, and you get some great data about trends. But in terms of individual identification, the next step for pooled testing or surveillance testing would be to, if a positive shows up, you individually test with the more sophisticated test the people in that group. I'm trying not to say cohort, to keep things a little bit clear, and kind of move the ball ahead that way, because that ultimately we need a little bit of everything to get to the gold standard. Obviously, you need that to control the spread. You need the positives, and then you need those folks to do the right thing in terms of isolating or quarantining. But surveillance testing or pooled testing, again, can really be helpful with trends, because that can show kind of where the clusters are, where the hotspots are, if you will, so that, if we can ramp up pooled testing in the schools and it shows that we're not getting positives, then we know we're doing a good job in the schools with our protocols and the like. And similarly, if it shows something else, then we can adjust and react to that. I guess I'll stop there, because I know there's a lot of questions and concerns about testing. So why don't we stop there? I don't know if Ruth or Julie have anything to add, and we can do some more questions after.
Yeah.
Ms. Clay, any further thoughts in that regard?
Yeah, I was just going to add that it's kind of a public health wonky kind of thing, where it's really interesting to us public health types, but for an individual person who really is concerned about themselves and their family, it's not giving them the information that they're looking for. And quite frankly, we're not a large population. If we were, Milwaukee or, large city that you could segment and get some trends, that would be one thing. But I think one of the things the mayor said is really true. Testing is changing, and changing so rapidly, it's a little head spinning. And not only are the antigen tests getting better, but the PCR tests are coming out in different formats, so that ultimately, really, the ultimate solution are for people to be able to test themselves frequently. And that's how ultimately people know early on, really quickly, that they're positive, and we can control it. And that's starting to happen. So as a society, we take advantage of the tools that we have as they get developed. The scientists have done an unbelievable job in the testing that they've developed so quickly, and we're seeing it continually change. And we'll keep responding to those changes. It's not a change your mind kind of thing. It's a responding to new information kind of thing.
Very good. Thank you. That's very helpful. We're just over the 1 hour mark. The three of you okay with a little more time with us so we can get to some more of these questions?
Sure.
Thank you. Thank you very much. Mayor Brodeur, and I'm going to ask you a question that I know you hear every day. We've seen it in a lot of these advanced questions. People are clearly frustrated with the lack of access to testing.
Sure.
We hear stories about delays up at the Square One Mall, which I think is the closest test site to us. Do we have any local testing, any more local testing on the horizon?
No, not on the immediate horizon. I wish I had a better answer for that. I'll try to tell a little bit of a story here, and hopefully it won't go on too long. So I think a natural question is, when we had a concern over the summer, with the Lieutenant Governor's help and the administration's help, we were able to stand up a free testing site essentially overnight. And over 2 days, we tested over 1,500 people with the kind of lines, quite frankly, that you saw that we're now seeing at the Square One Mall. And the natural question is, well, why can't we do that again? Well, for a bunch of reasons. One of the reasons why the state was willing to help us out in that way was because there were no free testing sites built out at that point. So it was that was the only solution on the table. And now those sites have multiplied. There's, I want to say, 18 throughout Massachusetts, but really concentrated, quite frankly, in eastern Massachusetts. I think the Square One Mall site is a particular challenge because they have such capacity there in terms of you can build a line that can last for 4 hours. But I've also heard from some of my colleagues that is starting to happen at Everett, Revere. Certainly, I would encourage people to keep trying, but there are some real capacity challenges there. There are also, just so folks know, I've tried to circulate this a bit on social media. The Mass Emergency Management Agency keeps a running, essentially, inventory and map of all the places you can get tested. There are certain restrictions that might apply, i.e., it might be only 18 or over, say, and the type of test and the turnaround time might be a little bit varied. But there are probably at this point a couple of hundred of those. It's not one-stop shopping. It does take a little bit of legwork, but those are other opportunities. The state has talked about and put out an advisory, I want to say today, that we received. It's kind of a municipal guide to standing up your own site. Candidly, it's not terrific. It essentially says, I don't think I'm being too flip or too reductionist to say, go find a vendor and do it. It's essentially the guide. That's a little bit more sophisticated than that. But it unfortunately is not that easy. There are some real capacity limits that everyone is kind of seeing. And there are places that are standing up some one-stop shopping. The Salem just opened they got crushed with volume as well. Had an opportunity to talk to Mayor Driscoll about their experience, and they did it. It is absolutely a one-off, meaning they have stood it up a little bit, and they're a very, kind of post-Halloween, they're a big tourist draw. They get a lot of people from all over, even though they tried to control that. So they did that, what will be 3 days of testing. It's probably going to cost them a couple $100,000. And I'm more interested, quite frankly, in trying to stand up something that is sustainable over time, because that is where the real need is. I wouldn't say no to anything, and we keep plugging away at anything we can. Sort of to reflect back a little bit on the Somerville surveillance testing. Somerville has the benefit of a tremendous partnership with Harvard and Tufts University and the Broad Institute. That is a very expensive venture, even though it is cheaper on a per test basis. I think the answer there for if there's going to be surveillance testing or pooled testing that's really going to be effective as a tool across Massachusetts is to really build it out as a regional thing. Because to Ruth's point, Melrose as a community may not be big enough to stand that out. If we can develop partnerships with those folks that we've started to explore, that is where I think we'd get the most utility out of that kind of a program. So believe me, I share everyone's frustration. We have had, some of my family members have had the need to get that testing. Ruth, I know you've sat in those lines yourself, and it is frustrating, and we will, we'll continue to look for alternatives, but in the short term, there's not a lot of great capacity or solutions out there, unfortunately.
Very good. Thank you for that, Mr. Mayor. Ms. Clay, are you hearing anything different among your colleagues and counterparts in other communities?
No, actually, and as the mayor said, I did actually get tested actually last Friday at the Square One Mall. So no, my counterparts are saying the same thing. To be honest with you, we're really in a fortunate situation. There's no testing, no Stop the Spread site on Cape Cod. So if you live on the Cape, I think the closest is Plymouth or Brockton. It's not close. Western Mass, the same thing. If you look at the 18 communities that have Stop the Spread sites, a lot of them are right around us. So I certainly understand the frustration of sitting in line, although I was pretty happy sitting in the car by myself for 2 hours, but that's just me. But we do have options, and quite frankly, the Stop the Spread sites return the results significantly faster than the private testing sites. So we do have people who are getting tested at their doctor's offices and some other private sites, but those test results are taking an average of 5 days to come back. And the Stop the Spread site, I was tested on Friday, and I had my test result at 4:30 in the morning Sunday. So longer than it used to be, but still pretty quickly.
Very good. Thank you for that. Dr. Kukenberger, if I could go to you rather. We've had a lot of questions about learning in the time of COVID, learning modes and models, and moving from one model to another. If I could ask you a couple of questions in that regard. And here's one. If a family in cohort 1 needs to quarantine, is it possible for the children to join the cohort 2 classwork for the week? If so, how would this be effectuated, and who would a family member or a caregiver talk to about that?
So anytime your family is having experiencing a challenge, whether it's because you're quarantining or someone has tested positive, we want you to talk to your nurse first and make sure that we have the proper timeline and all the supports are in place for your family. When it comes to anything related to your child's academic programming or learning plan, the first stop should be your classroom teacher, to talk with the classroom teacher about what's possible and how your student can stay connected to school. One of the things that has happened this school year is that, you're not just present or absent, you now are physically present or physically absent, or you can be virtually present or virtually absent. And so we want students to be virtually present when they're quarantining, so long as they're asymptomatic and they're feeling up for it. If a student is experiencing symptoms, we want them to be absent. We want them to actually take time to heal their body and to take care of themselves. And the same is true for our staff as well. So it kind of depends on what's happening with you. If you're quarantining, we want you to finish your full quarantine. We're not able to just flip and flop. It sounds silly, like it should be like, sure, come on in for cohort 2, so long as you're done isolating or quarantining. But a lot of depending on the school, the cohorts are filled to their max. That was very strategically, our children were very strategically placed in those cohorts at the elementary level. We also, in addition to prioritizing siblings being in the same cohort, we also prioritized shared caregivers. So we know that many families are choosing to pod even after school or on their learning from home weeks. So we want to make sure that we're keeping those cohorts. That's part of our risk mitigation strategy, And so, the unfortunate answer is no, we're not allowing students to flip to a new cohort if they are missing their in-person week.
Very good. Thank you for that. Eating lunch in school versus eating lunch at home. We clearly made a decision to have lunch at school. Has there been any further consideration about changing that and ending the school day earlier and having students go home for lunch?
We're always considering a lot of things. That is not something that I would be advocating for at this time for a couple of reasons. Number one, it's about access and equity for me. Many of our students, that's the meals, the most guaranteed meals they get are the meals they get at school. And offering a grab and go option, we just know that not as many students eat the meals or take the meals when it's a grab and go option. We still offer it. If you come in the high school on any given day, you're going to see breakfast right there. Any student can grab it on their way in the door. We're also doing grab and go this Wednesday for our noon release because we know that there's some students that really rely on our meals. But having the lunch during the day is essential part of the school day. And what we're seeing is that we're able to have lunch during the day and it's not causing any additional spread throughout the school from what we can tell. And so there isn't really any evidentiary reason to do it, I guess I would say. And I do think shortening the day, again, it's already a shortened day for families, would really pose a hardship on our working parents. And again, I think that's an access and equity issue. If you're a family who's able to have someone pick your child up and take them home, then that may not be as much of a hardship. If you're, a two-parent or a single-parent working household, you might not have that same luxury. And my worry is that if kids aren't in school, they're going to be in other places. They're going to be potting with other families. They're going to be sharing caregivers. They're going to be going to the Y for childcare. And what we know is that really school is one of the safest places for our kids to be right now. And so I would have a hard time, based on what we know at this moment, reducing the day any further.
Very good. Thank you for that. So I'm going to ask you a series of questions, Superintendent, but they all amount to the same thing or the same question, which is why not remote now? But let me give you these questions by way of prompts. With the community infection rate rising, why aren't we going back to remote learning? What would be the specific deciding factor to put all schools remote again? Somewhat more specific, I would like to know when MPS would be considered to be at the threshold at which schools would be closed based on COVID infection rates. With the COVID-19 cases in Massachusetts on the rise, why is there a continued push to keep children in school? So again, ultimately the question is, given what we know, given what we've been talking about tonight, why not a decision to go remote?
Sure. So my answer is going to sound a lot like why not shorten the day and just have everyone do lunch at home? It's about equity and it's about access. For many of our students, school is the safest place that they come to each and every day. They rely on us for a whole variety of social emotional supports in addition to the academic supports. And so we know that when students are able to access high quality education, they're able to thrive. We know that our mission here in the Melrose Public Schools is to ensure that each and every student can realize their own unique potential, and in-person learning is essential to delivering on that mission. And so why are we not going full remote right now? We don't really have any evidence that says that it's safer for students to be home right now than it is for them to be in school. And we believe that by offering the best fit model, families are able to make individual choices based on their individual family resources, their individual family health, and the individual needs of their students. And so that is something that families have a choice to do right now. We just asked all of our families who have students in grades 1st through 8th grade if they wanted to change their child's learning model at this time. We had 1,028 responses because we also asked for feedback from all families. Of those responses, there were 53 requests to change their learning model. That number is going to go up or down. I know that some people, through conversations with the principals, have said things like, oh no, that's not what I really wanted. What I really wanted was this. So we're in the process of just refining that data. Of those 53 requests, 20 of them were requesting that students go from MDLA into the hybrid model, and 33 of them were requesting that students go from the hybrid model to the MDLA, which is our fully remote Melrose Distance Learning Academy. So we believe that we're creating opportunities for families to make those choices, but ultimately, in the big picture, the best place, the safest place, the most appropriate place for our students to be is in school with us, where we have protocols in place that are proven to help mitigate the spread and mitigate the risk. And we know that if we aren't providing that daily education to our students, families are going to have to come up with other creative solutions. And they may or may not have the same level of supports that we have in the schools to mitigate the risks.
Very good. I want to talk about the other side of the coin with regard to in-person versus remote. But let me jump back to contact tracing. We've had a follow-up question. And Ms. Clay, if I could go to you with this. We talked about contact tracing involving kids, and as we know from looking at the questions, people expressed concern about the efficacy of it in terms of what kids were representing. If we weren't talking to students and we were just talking to parents, were we getting the whole picture? What I didn't ask you, Ms. Clay, is if at any point we were also talking to teachers about this. And you're muted. Sorry.
Sorry. Yeah, of course we're talking to teachers. They're the ones who are in the best position of knowing exactly what's going on during the school day. I mean, parents can answer our questions about who their kids' friends are and who they may see before or after school, who they walk to school with, who they walk home with, things like that. But only the teacher knows the dynamics or any incidents that would have happened.
Very good. That's very helpful. Thank you for that. Back to you, Superintendent. We talked or we answered the question, why not remote, based on what we know now. The flip side, why not in person? And I think ultimately the question is, why not full in person, based on what we know now, based on the use of proper PPE and safety measures and health and safety protocols, based on what we're seeing at some of the private and parochial schools. And the further question, if not full in person now or soon, when, in your estimation, based on what you know now, and what might that look like?
Sure, that's a great question and something I've been thinking a lot about since March. The real answer, the shortest answer, I guess, is that the only way for us to be fully in person at this time would be for us, for everyone in our community to feel ready to take on more risk. We would have to minimize our physical distance. Even 3 feet would be tricky 3 feet of physical distance would be tricky for us to get all of the students back in person. Some of our class sizes are at 28, 29, 30 kids in a class. And so in order for that to happen, as it did pre-COVID, students' desks are basically touching or, very little space in between them. And so we would need to be at a place where we all felt that there was no longer a need for physical distancing. And I just don't believe that we're there right now. And I know we talked about the Hoover cases before. That was a situation where the 15 cumulative minutes was not able to be maintained, or I'm sorry, the other way around. The 6 feet of distance was not able to be maintained for the entire school day. And in fact, every student who was present on that day was identified as a close contact. So that tells us that 6 feet on top of the mask wearing and the hand washing and the staying home when you're sick or have been exposed are important. It's not one thing. We have to do all 4 of those things at the same time. And so to just take a prong out of that equation, I think is extremely risky, and now certainly does not seem to be the time for us to make that consideration. But with that being said, we are beginning to start conversations with our teachers union about what would our transition plan look like to get back to more students learning in person more frequently. And I think there's a lot of steps we can take. For me, a high priority is looking at our youngest learners. So how could we creatively think about getting all of our kindergartners in every day, all day, like our Group C students? What would that take? Could we then do that for first grade? What would that take? We might have to use different spaces. It might not look like a traditional classroom, but those are some of the things that we're starting to think about and brainstorm ideas about. Some of the other things we might do before we minimize the 6 feet of distance is increase the number of transitions. So right now, all of our elementary students are still receiving all of their specials remotely. So if we were thinking that we're ready to take a calculated risk, that might be something we consider adding before we minimize the 6 feet of distance. Another thing we could think about is, increasing the amount of synchronous instruction that happens during that learning from home week. To me, that's not physically getting more students in-person learning, but that's another step that we could take toward that direction. One thing that we are planning to do at the elementary level is to begin providing in-person service deliveries for some of our special education students, depending on the type of service that they deliver. That has been remote to date, and that again was one of our risk mitigating factors, just trying to minimize the number of people that children come in contact with each day. On November 30th, our plan is to begin implementing more special education and service delivery. So that's sort of like a step toward that more in-person learning.
Very good. Thank you, Superintendent. Mr. Mayor, if I could go to you. The matter of mask wearing or not and social distancing or not is a hot topic in Melrose and elsewhere. What do we know, and we talked a little bit about this earlier, what do we know about enforcement of the rules and the guidelines? What can we do? And again, you've seen some of the questions we've been receiving over the past couple of days. People are seeing groups of kids, and I'm sure you're hearing this on a daily basis, separate and apart from this program, Mr. Mayor. People are concerned about seeing groups of kids and the thought that those kids are congregating and not social distancing and not wearing masks and then going right into school the next day, or even just going home and potentially carrying or transmitting infection. And it's not just young adults or children, it's adults as well, as you know. One of the specific questions in this regard, Mr. Mayor, as you know, is this something that the police could play a role with regard to, or do we have any other enforcement mechanisms?
I want to start with what I already said, which is we aren't going to enforce our way out of this. There's not the capacity, it's not the will, and quite frankly, I shouldn't say it's not the will, and we shouldn't have to. Again, it really does come back to that idea of a social compact. Most of what I hear, interestingly, is about the kids, and I have no doubt that there might be kids up at the Common or whatever the gathering place may be. But I tell you, I mean, I get around the city quite a bit, as you might imagine, and I've been in the schools a little bit, less than I would like to, but probably from a safety perspective, that makes sense. And what I've seen from our kids is, for the most part, outstanding, quite frankly. I've seen it on a lot of the practice fields, not 100% consistent. I've seen it certainly on the walks to school, seeing kids do that, and vast majority of the kids doing the right thing in school. Kids have been terrific. Again, that's probably the most controlled environment that we have. So I do want to give the kids a little bit of a shout out, because they've been good, and it's hard for them It's hard for everyone for sure, but it's particularly hard for them. And I think they're doing a pretty good job, all things considered. And I think all our residents are. I'd like to see our adults do a little bit better. Quite frankly, folks may have seen, I had the opportunity to go down to the city yard over the weekend to drop off some leaves. And, not all the residents were complying with the order. And again, there's certainly been a robust debate about the science and the efficacy of that. And for sure, I guess I would grant a little bit of that, but it's the governor's order, and I don't think it's really smart for folks to pick and choose what public health directives they think it's a good idea to comply with and which ones they shouldn't. There are some very well-meaning, hardworking, super smart people that are working on this, and they think a lot about it, not just about the absolute science, but what is the most effective public health policy, which is a combination of hard science, human behavior, and a lot of other things to get to what will protect people. So that was a long, probably too lectury answer. From an enforcement perspective, the police, the Melrose Police Department is absolutely empowered to enforce. The health department is empowered to enforce. Now, obviously, there's a sense of scale that needs to happen. And I'll give you an example. So what are the Melrose Police doing? The Melrose Police will respond to calls, but what they are going to do, certainly in the first instance, is they have masks in the car, in the cruisers, and the responding officers are going to we'll use an event at the Common, or a gathering at the Common as an example. They're going to get out. They're not going to ticket people. They're not going to arrest people. They are going to explain the situation. They are going to say, look, I have masks available. Here's what the rules are. And quite frankly, here's why it's important. And again, reflect back on, you may not think this is a big deal, but it is, and here's why. Because it matters for protecting your kids, your neighbors, so you can get back to school, so you can play those organized sports. Same thing on Main Street. If are the police going to go up to individuals that aren't wearing a mask? For the most part, probably not. But they will have that opportunity to intervene, because again, we do not have the capacity to respond to every single incident that might be violative of the governor's order. And we will do our best. We will certainly want to respond to big incidents as quickly as we can. But again, what is going to save the day is that, everyone kind of internalizing the message that these basic public health procedures are what's going to get us to the other side.
Thank you, Mr. Mayor. And certainly a recurring theme this evening, this notion that this is very much a community problem and not necessarily susceptible to a government solution, certainly not on its own. Ms. Clay, everything the mayor said in keeping with your views as to enforcement?
Sure. The only thing that I would add is that we do respond to complaints about businesses who are not following the protocols. So we do go out and investigate every one of those complaints.
Very good, thank you. And while I have you, Ms. Clay, we did have a couple of questions about community data. And the questions essentially were, where can people get data? And some folks were looking for some rather specific data, infections by age group, number of hospitalizations, number of deaths, and sources of infection. Is that kind of data available to the public? Is it something within your control? Is it a state database?
Yeah, some of that we can do, like the numbers of deaths we can do. I'm working with the state to see if we can whether through that Maven electronic system that I was telling you about, whether we can do reports that can break down by age. Probably not by source of infection, because that's, there's a lot of times we don't know. A lot of times, especially if it's an adult, they don't know how they became positive. But if we could be able to break it down more by age, that would be helpful. That information is available statewide on the state's website, but not by individual community. So we're working on seeing if we'll be able to do that.
Very good. Mr. Mayor, a rather specific question. Home for the holidays, happening, not happening? Where are we?
Essentially, no. As you might imagine, like any other large gathering, it's not going to happen. I will say, though, the good news is this, that the chamber and the city and some terrific volunteers are all working together to create essentially a holiday spirit. And we're never going to replace, but to try to generate some of that energy. So, Small Business Saturday is kicking off this Saturday. It's kind of the kickoff to what, the retail season, if you will, around the holidays. And we also are going to stand up what we hope will be really successful. It's kind of a buy local challenge where we really message and encourage people that to the extent the holidays are about shopping, that there really is a tremendous array of goods and services that you can find right here in Melrose, some very unique stuff with some businesses that really support the community and that really have some unique goods and services that they can offer. And that will be really a constant drumbeat because those places are very much at risk. They don't have the infrastructure like an Amazon, which we look, it couldn't be easier these days, right, than to order from Amazon. And I get it, but I think folks will be pleasantly surprised by how much they can do downtown. And despite some of the obstacles around COVID, that these businesses really are stood up to deliver services and retail in a little bit of a different way, with curbside pickup, with appointments, with some online or telephone service. And we'll do that. And that we're also recognizing that folks are really facing some challenges, economically, and the emergency fund will continue to be there. We're also going to try to stand up or support some of the stuff that are around the giving trees and things like that, and particularly around food insecurity, which I think a lot of people think is not a Melrose thing. It is not compared to some other communities at Jones, but it is a big and growing challenge, and we'll be focused around supporting that as well. So both we are ready to help folks exercise their charitable impulses, to be sure, and we really also want to encourage people, I can't say it enough, to support our local businesses. They really need our help, and quite frankly, they deserve it.
Very good. Thank you, Mr. Mayor. And that's probably a good point at which to wrap up. With long past our allotted time. Thank you, Mayor Brodeur, for your leadership and for organizing this event. Thank you, Ms. Clay and Dr. Kukenberger, for being with us for our program, and for your terrific work, both of you, during this extraordinary period of time. That's it for this episode of Ask Me Anything Melrose. Thank you for being with us. Thank you to those who submitted questions. And please accept our very best wishes for a happy and healthy holiday season. And as always, mask up, Melrose. Thank you.